thanks to Sue Perks and to everybody else who organized this magnificent conference. It's really, really enjoyable to be here. And it's quite an achievement to get a second conference about symbols. It's I think, one of the first times in history that we managed that. In the next 20 minutes or so, I would like to focus on information that patients receive about their medicines, and specifically about icons and pictograms in that area. I'll start with a few examples. In the real world, things look like this. This is a box containing a COVID antigen test. And I expect that most of us will have used some of these tests in the last few years. Fortunately, my wife came back from her holidays on Monday and was fairly ill, did a COVID test yesterday with exactly the same box, and unfortunately that was positive. So these boxes are still used. But I'm interested in the pictograms on this particular box, or these boxes of COVID tests. I look at these pictograms and I try to decipher them. I'm not going to discuss these pictograms in details, but let me ask more general questions. Are these pictograms on these COVID boxes really a good way to inform people on how to use this test? I'll give you a second example. This is a packaging of a simple plaster. They're used to stop bleeding, bleeding if of a small wound on your skin. It's not immediately clear which layer of plaster you should have to separate. You just have to try to open the package and peel back the cover. But if you look at, I think I can use the mirror, you can see these pictograms on this line here and here. I'm not sure if anybody tries to decipher those and what they actually mean. And if you have time when you're bleeding and you try to put plaster onto your skin. But it gets more serious even than that. This is a box for a medicine called Epilim. That's medicine against epilepsy, and it can also be used as a mood stabilizer against depressions. And I'll focus on the pictogram. It shows a side view of a pregnant lady, recognizable because of her extended belly, her breasts, and her ponytail. The red circle and the diagonal red line are similar to a traffic sign, which means you're not allowed to or do not. And the text below it states, warning for women and girls. Of course, there's a conflict immediately because warnings in traffic sign are not circles, but they're triangles. But this is on the front of the medicine bag. And it's very clear, isn't it? It turns out that Epilim causes malformations and brain defects in unborn babies. So it's a very serious warning. These pictograms were added in 2017, 7 years ago now, when a group of French women sued Sanofi, which is the manufacturer of this medicine. And Sanofi had known of these side effects for a long time before that, before they started warning women not to use it. And Sanofi believes that this pictogram and this text around it will warn women sufficiently that they should not take this particular medicine. However, the court cases are still going on. There was a court decision in 2022, which awarded about 400,000 euros to one family. In France, it is likely that between 2,000 and 4,000 babies were malformed, and around 30,000 babies have very severe brain defects. So Sanofi is not out of trouble yet by simply putting a pictogram on the box. In the UK, research has shown that nearly 50 women every year were prescribed this medicine while they were pregnant. So my question is, can a pictogram on a medicine box really help prevent these birth defects and malformations in babies? So I started collecting some pregnancy pictograms. There's a substantial variety in all sorts of elements in these pictograms. In this tiny collection, there are already 10 different ways of saying no and 2 different ways to indicate a warning. But which one of these would really bring the number of pregnant women who take valproate to 0? Which pictograms will be most effective? I've shown you some examples now in the medical world of COVID tests, of plasters, and of medicine boxes. And it's clear that we believe that pictograms are very helpful for patients. And this belief seems to be based on 3 things. In the first place, patients need to be informed about medicines. For many patients, it is difficult to understand written information if it's only provided in words. Pictograms and text in combination are better understood. Second reason is that pictograms help because they are easy to understand if they're designed well. So pictograms on their own, if they're really well designed, should be able to convince patients, in this case women, not to take this medicine. And the third reason is that medical authorities in the USA and Europe stimulate and approve the use of pictograms. In the last few years, both the Food and Drug Administration and the European Medicines Agency have promoted the use of pictograms on medicine packaging, in packaged leaflets, and in clinical trials. There's only one minor problem. How can we select the most effective pictogram? Which brings me to the second part. What is a pictogram? And before we discuss pictograms or symbols or icons or any of the other words that we use with, before we can discuss if pictograms could help to make information on medicine boxes more useful, we need to figure out what we actually mean by pictogram. And the medical world only trusts evidence-based conclusions. Most of this is published in peer-reviewed academic journals. In the medical database PubMed, there are 602 articles at the moment about pictograms. About half of these have been published in the last 5 years. And I think that's a positive thing because it shows that the medical interest is definitely increasing. But if you start looking at these pictograms, at these articles, at these publications, then I start getting worried. I made a list on the web at the moment of 18 systematic reviews and checked every study these reviews refer to. At the moment, the list contains 210 articles that have studied pictograms. This list is on my website. It does not only contain the academic references, but also the actual pictograms and pictures and illustrations from these investigations. So at the moment, I've collected and read about a third of all the available articles. In this slide, I've put some pictograms together that are published in academic journals. You can see that the author really means pictogram because I've kept the caption and the illustration together. This is how pictograms appear in medical journals. So Ross Dowse, on the top left-hand corner, calls these images USP pictograms. And Peter Peterson will recognize these, I'm sure. What I would like to focus on is that these images are all very different. Some stylize the objects, some are more abstract, some are fairly natural drawings, some indicate sequences, and some combine images. And all use graphic marks such as crosses, arrows, symbols, and shapes. But in academic literature, specifically in the medical literature, all these different types of images are called pictograms. I'll show you one more example of an article published 2 years ago in the Saudi Pharmaceutical Journal. And the captions of the illustrations show that the authors really talk about pictograms. But even in the same article, there are very different types of pictures. So the overview of peer-reviewed academic journals shows that the word pictogram can refer to many different visual representations. But medical journals are not the only available source for pictograms about medicines. I had a quick look at some collections of visual representations that are used outside the medical world. These are two examples out of a lot. On the left are is a collection of symbols designed by the Dutch Pharmacist Association, KNMP, in 2015. I can see Paul Marx smile, I think. It was heavily promoted for a few years, but most of this has disappeared from their website. Only a few of these symbols are still in use. And on the right is a collection of medical icons that can be obtained from the software developer Adobe. This is only a small selection of the available medical icons they have. And there are many more of these collections. For example, the Noun project has more than 1,300 icons that show a pregnant woman. The Noun project has 1,600 icons for an infusion bag. So these collections of pictograms or icons or symbols do not bring us much further in defining what we are looking at. The terminology is clearly inconsistent, and that I'm only talking about medical academic journals. It's not clear what pictograms or icons or symbols or pictographs or images or other graphics are and what they are and how we can distinguish them from each other. And there is a wide variety of visualizations. Some are very abstract, some include text, some are cartoon-like, some use stick figures, some use color. The variety is endless, and they do not have much in common apart from that the authors call them pictograms. In order to separate these visual representations from text, it might be easier to use a more encompassing word like image or picture instead of pictogram. And that brings me to the third part. How can the impact of these different types of pictures be established? If there are so many pictures available, how can we select the most effective ones to achieve our aims? Again, I refer to the medical literature because that is what is trusted in the medical world. And the gold standard to check if a medical intervention or a medicine is effective is to write a systematic review about double-blind clinical trials. Adding a pictogram to a text is seen in these studies as a medical intervention. And until now, 18 of these systematic reviews have been published about pictograms. And all these systematic reviews look at slightly different things. For example, do pictograms affect recall? Can people remember what the image was about? Do pictograms have an effect on adherence? Basically, do patients take their medicines better or more accurately when they see a pictogram? Do pictograms improve understanding? Or do they attract the attention? And the results of these reviews are not very surprising. So if you read 200 academic articles, this is the result. The academic literature points to 4 effects that pictures or pictograms or symbols have. They attract the attention and they can be processed faster than text. Pictures can be recognized and used to identify things. Pictures can convey information and aid comprehension and understanding. And pictures can help to remember. They help retention and recall. And these 4 types of impact of pictures have been proven over and over and over again. But if the authors in the medical journals had looked slightly outside the medical area, they would have concluded that these conclusions are not really new at all. 2 criteria are less clear. Pictures might facilitate conversations. They might lead to better recall score of a consultation. Basically, what people have tried is to provide patients with pictures on cards, and in the conversation, the doctor or the patient can say, I want to talk about this specifically. And second thing is patients simply like texts with pictures more than text without. Doesn't have any effect or anything. It's just patients like pictures. But there's one very clear conclusion, and that's very worrying for the medical world. There is no evidence in the 210 studies that pictures affect adherence of medicine treatments in any way. Patients do not take their medicines better because the instructions contain pictures. But while I was checking these 18 systematic reviews, I started to worry. These reviews compared very different types of pictures and compared them without mentioning that the design of pictures is relevant. One review, for example, looked at 17 articles. I checked all 17 of them. In the 11 out of 17 original articles, the pictograms were not included in the text. So the author of the review assumed that all pictures were very similar and could be compared directly. But if you read these 17 articles, I haven't got a clue what kind of pictures they're talking about. We're not included in the original articles. Bluntly, those articles should be discarded immediately. Furthermore, the context in which these experiments were done varied a lot. Some were done in universities, other by pharmacists, some by doctors in hospitals. The reviews ignored these different contexts, and we all know that pictures are interpreted within a context. If you take that context away, the interpretation gets a lot more difficult. But most problematically is that the reviews ignored differences between participants, the people who actually answered questions about what does this pictogram mean, or what should you do with it. For example, an elderly lady in India who has problems reading was directly compared with parents of asthmatic children in Sweden. These people have very little in common, and it's very unlikely that they interpret pictures in exactly the same way. So comparing all these available systematic reviews about pictures cannot lead to generalizable findings. The effects of pictures are local and cannot be generalized outside the context in which they are used. So Can't we say anything about the impact of pictures on individual patients? And of course, there are a few things clear. The effectiveness of a picture depends on the design of the picture and its visual environment, the context in which it is interpreted, the characteristics of the reader, and the action that is required. What do people need to do after they've seen the picture? But pictures do not have inherent qualities that makes them effective. If we look at a picture, we can't say if it's effective or not. We have to ask people to do that. The idea that pictures are understood by all is a fallacy. Pictures need to be embedded in a context to make them useful. And that brings me to my conclusions. And I only have 3 conclusions. The first one is about pictograms and medicines. It's clear that the terminology in the medical journals is an absolute mess. There's no clear description of pictograms, nor of any of the other visual representations. We need to avoid a narrow definition that is used in the legislation in the USA and in Europe, for example, and make sure that all sorts of pictures can be used on medicine packaging and medicines information. But the main point is that we must show the visuals in research publications. The pictures need to be shown in order to make a valid judgment. How we actually call them is less relevant. Conclusion 2 is that the second is about the effectiveness of pictures. The conclusion is that pictures do not have inherent qualities that make them effective. Effectiveness really depends on the interpretation by people in a specific context. And the main point of that is that the impact of pictures is not generalizable. This conclusion is in stark conflict with the conclusion of the 18 systematic reviews in medical journals. And the final conclusion is that the effectiveness is based on people acting appropriately. All forms of visual communication are absolutely essential to enable people to act. Pictograms, or whatever we want to define them, or however we want to call them, are essential part of communication with patients. We just need to ask patients 3 questions about every visual. What do you see? What does it mean? And what will you do? It's clear that we don't need more pictograms. We need to involve patients to find out how pictures can enable them to act. And we need to convince the authorities that adding more and more and more pictograms is not really helpful. Thank you.